Thanks. Right now, about 30,000 new coronavirus cases have been reported across the state. The governor warns that number is low because fewer people are getting tested. Hospitalizations also up 18% in the last 2 weeks. 97 people have died since yesterday.
On hospitalizations, we've seen a 7-fold increase in just 2 months. On ICU admissions, we've seen a 6-fold increase in just 2 months. So it shows what can happen in a very short period of time.
You're in the Bay Area. ICU bed availability stands at 7.9%. That is an improvement from 5.1% on Saturday. But the goal, of course, reached the 15% target before lifting current stay-at-home order. Southern California faring much worse. The ICU bed availability there remains at 0%. KPIX 5's Devin Fehely live in San Jose to explain how public health officials are trying to avoid a worst-case scenario, either running out of beds or nurses and doctors to staff them. Devin?
Yeah, there's something that's pretty frightening that happens when a healthcare system reaches its breaking point. It's called care rationing, and basically, in simple terms, it means doctors decide, I think this patient's got a better chance than this one, so this one gets the bed and the ventilator and this one doesn't. It is an awful situation for everyone involved, the healthcare providers making those decisions and the patients on the receiving end of them. And public health officials say we are not so far away from that becoming reality.
We've been at capacity for over 6 weeks.
Dr. Paul Zilka runs the emergency department at Regional Medical Center in San Jose. His staff has treated more coronavirus patients than any other hospital in Santa Clara County. During our interview, Dr. Zilka said the hospital was on, quote, diversion, turning new patients away because they were simply too full and too overwhelmed to help.
We're always making sure that the sick are getting the care they need, but there's considerable waits and delays for those patients.
Public health officials say the regional stay-at-home order that was put in place after Thanksgiving was designed to slow the virus down, to prevent us from running out of beds and equipment, and more importantly, nurses and doctors to care for sick patients.
It's not just rationing care to people who have COVID. Everyone gets subject to that rationing. So it's really a matter of who has the best chance of recovery from whatever condition they have. We are not quite there yet in our county.
Dr. Kamal says every hospital countywide has been instructed to come up with a care rationing plan just in case they need it later.
It's just been getting tougher and tougher. I don't know how much longer we can last.
And it's not just hospitals feeling the pain of the post-holiday surge and stay-at-home orders. Business owner Jim Angelopoulos says his restaurant, Yoked, is on life support too.
I think we have about another two months before we run out of any reserves. It's just been going from bad to worse.
So they're doing the diversion, Devin, but at what point are hospitals going to start that rationing of care?
Well, as you can imagine, it is the absolute last thing that a doctor wants to do. And so if you've got 3 beds and 2 patients, you're not in that situation. Really, that's going to kick into effect when they have more patients than they have beds and equipment and staff to deal with.
All right, Devin Fehely in San Jose, thanks so much.